The Caribbean Council for the Blind, CCB Eye Care Caribbean, implements 1-month optometry and refraction clinics at the Clearview Psychiatric Hospital and the Fines residence for the elderly. With the implementation of both clinics, the CCB, in association with the government of Antigua and Barbuda, moves closer to the goal of Class 1 eye care services for all persons living in the country. Terry Andrew tells us more.
Commencing this week, CCB began implementation of a series of 1-month eye clinics at the Clearview and Fines institutions. Through the month of February, more than 500 residents and staff of both institutions will be screened for all major eye conditions endemic to the Caribbean. Additionally, all employees and residents of both institutions who need prescription glasses will receive their spectacles, compliments of the Caribbean Council for the Blind. CEO of CCB Eye Care Caribbean, Arville Grant, says his organization relishes the opportunity to be able to provide the service to persons.
One of the very, very important things in life is the ability to use one's sight. I mean, I've been able to get along without much of it, but it's a long haul and it's an expensive process. So we know that anything we can do to help persons keep their sight or have their sight restored is profoundly important to national development. And so that is part of the reason why we come together like this and why we spend the resources we're spending to put this kind of service in place.
Grant says every person who is 35 years and older should have a habit of having a regular eye examination annually or every 2 years to ensure that none of the conditions that led to blindness occurred before it is detected. Superintendent at Clearview, Clarence Pilgrim, and Master at Fines, Alton Ford, were excited for the added service for the patients.
We are very pleased to be in partnership with the Caribbean Council for the Blind. This falls into our program of providing holistic health care for our patients. Not only do Clearview Psychiatric Hospital meet the mental needs of our clientele, but we also look at their holistic well-being, body, mind, and soul. We believe strongly and firmly in the fact that you cannot have one without the other.
The resources have been coming from the main hospital or main treatment centers to the community, and that is a very good thing. Very positive, and I just want to thank CCB and to say to Orville, please extend our greatest privilege and confidence in being able to be part of this particular activity today.
Dr. Errol Court, also an enthusiast of the idea of the service at the institutions, expresses the government's views on the partnership.
We're also equally impressed that the program is rolled out not only to persons out there who may be able to help themselves, but more importantly, to those who are in institutions who clearly are unable to help themselves. And therefore, Arville, it is a proud moment for me and for the government that we're here this morning at Clearview to start this program and to ensure that persons who are in this institution and persons who are assisting those in this institution will benefit firsthand from this very useful program.
The initiative being undertaken by CCB Eye Caribbean is in keeping with its mandate of preventing blindness and visual impairment while restoring sight and creating opportunities for persons whose sight cannot be restored. Terry Andrew, ABS News.